financial advisor. I think I knew towards the end of that it wasn't for me, but I followed through, went through with it, and ended up, once I became a financial advisor, quickly found out that, yeah, my gut was telling me the right thing. I wasn't in the right field. So, I was doing some soul searching, and before college, during college, and afterwards, my family has a horrible cardiac history. I'll be doing EKG on myself probably years from now. Horrible cardiac history. So we were in and out of the hospital with my uncle and my grandfather, and all throughout that time. And during that time, you're working with the team, many different aspects of the team, whether it's physical therapy, whether it's a phlebotomist, a nurse, a physician. And something that always stuck out to my family and myself was the nurse. They were the consistent advocate for my grandfather. They were there when he died. So it was awesome. And that had a lasting effect on me. So I ended up wanting to get back into and go to nursing school. And what ended up happening was I had such a good time at York College the first time. I reapproached them in hopes that they would honor some credits going back, and they did. They worked with me, and it was really nice. I was able to get back into clinicals very, very quickly. So honestly, what drew me there to begin with was a lot of my family and friends that went there before. So I had actually had multiple opportunities even before I graduated. A lot of that was, hopefully it was due to me and my good studying, but no, a lot of that was due to the professors have a great relationship with a lot of the different hospitals and the clinical sites that we ended up going to. And so fast forwarding several embarrassing moments, actually moments of growth, so they tell me, and some nursing years later, I became the nurse manager of these 3 units. And I was excited. So I was excited to take over a critical care area, which there's always a lot of action, and really elevate the critical care level that we were performing at, and big into quality. So working on things like catheters, line infections, and things like that, ventilator associated events. And and we were actually doing a great job of it. And then, of course, what hit everyone was COVID 2020, which apparently are the 2 newest additions to the Oxford dictionary as far as curse words. But really that sets us up for the content portion of this. What was different for my staff? What was different for me as a leader, nurse leader going through this? We had a lot of parallels, and there were some differences too. And really, it was a timeline of different emotions along the way, and that's what we'll go through. And then at the end, we'll do some questions. So how this started, kind of the journey and where we are now, all started with us getting little snippets of this, COVID. We're hearing it on the news, or we're hearing these little bits, but it wasn't here. We're kind of living vicariously through some colleagues across seas and different things like that. And then there was this moment, because we knew this was coming, where I was told that, we were going to have to transform the unit into this COVID ICU, and they were cardiac staff. And, I was thinking over how to go about doing that. And that was a tough day. So we went down to the staff, myself and my clinical coordinator, drew everyone together, and I can really still remember it was like 2:30, 3 o'clock. And we had to tell them, you're going to become the cardiac ICU here, or COVID ICU here at York Hospital. And a little bit about York Hospital, it's kind of like the mothership of all of WellSpan. We take the sickest of the sick within our system, and we take some from outside of our system. So what that was met with was kind of that first phase in that timeline, which was fear, because it was unknown and ambiguity, and none of that is a good mixture for confidence. So there was a lot of fear there. They were scared. They have mothers, fathers, your parents, your grandparents. Some of my staff have immunocompromised kids. Where did that leave them? I had pregnant staff, and the CDC and everyone in the world is trying to catch up on something that we just didn't have enough knowledge on. So that unknown is something that you're going to have to deal with in nursing it's not just COVID. You know, there will be another unknown, and there will always be another unknown. So what ended up happening was, despite that fear, as nurses, we like to brag a little bit, I think, that no matter what, we take care of everyone. And it truly does not matter background, it does not matter what sickness they have, and that's what makes nursing beautiful. So they took that fear and they really utilized it. Now they did, I can, going home, my neighborhood probably has about 7 families that someone works in nursing or they're a doctor. And everyone was so afraid of transmitting to their family, they were all disrobing outside their house, which left a few lingering scars in the neighborhood, I'm sure. But yeah, people were afraid. And honestly, the unknown, it's always scary. But that fear kind of drove us to be more steadfast, like drove us to be more meticulous. We overcompensated greatly, which was a good thing, on how minute the details we got down to, every surface that we're wiping constantly. And in the end, it actually potentiated us to provide even safer care. You know, it highlighted new ways to do things. But all that being said, you can do all these new things, but we had to bring it back to the basics, back to you know, what evidence-based practice dictates, and that's what nursing runs on. You know, what the evidence says. It's not just random errant feelings or ideas. It's evidence. And it makes it more pure. So back to the basics meant going back to what we learned. You know, I can still remember in a York College class, one of the first ones where you're learning about donning and doffing protective wear, some PPE, and the hand washing, always the hand washing. So, you know, we had this class or a session, I should say, where you had your hands with gel and covered it in gel, and then you shined a light on it after you wash your hands, and you know, it were scoured over to see if you missed anything, and if you didn't do it right, you were doing it again and again and again. And of course, at the time, you know, you're thinking, why are they so serious about this? Well, there's a reason, and that reason proved true in the pandemic. It proved true the second that I got out of clinicals, you know, and it helped. And with these very, very sick patients, those basics follow through the most complex of situations. So it was a great throwback, and I'm saying that pulling some silver linings. It was a great throwback. And so moving into that, we had to take care of these extremely sick patients. So, and I don't know how many of you are familiar with some ECMO patients, but it's basically like bypass for your lungs. So they're normally 1-to-1 patients. They were on multiple medication, IV medications to keep their blood pressure up, paralytics. So our seasoned nurses, even, you know, it pushed them, but it also pushed who I love to hire, and that's new grads. And they had a lot of passion for it, and they thrived in it. And they've really, gosh, it forged them into some amazing nurses afterwards. So over time, honestly, so we had that fear phase, and then we went to the next phase because it was weeks, it was months, and you had to keep, you know, you couldn't get weary and you couldn't just let things slip, because that happens, you know, it starts to dull down and that fear starts to go away, and then mistakes are made. But over time, honestly, fear was replaced with moral distress and emotional distress. You had families. It was no longer unknown at this point. There was no ambiguity. We had a lot of patients that didn't make it. A lot of patients passed away, and because it was a COVID ICU and one that really coagulated all the sick patients of the system, there was a decent amount of high mortality rates. That being said, the nurses are sitting there holding, you know, Zoom tablets so that the family members who weren't allowed to come in could see their families, and you know, they were seeing them possibly for the last time. And some of the tough parts were right before, you know, you're about to intubate someone, put them on mechanical ventilation, which after they're on mechanical ventilation for COVID, their chances of coming off mechanical ventilation are severely low. So that intubation, that mechanical ventilation, we know is a tipping point. The patients knew it, the families knew it. So they're maxed out on everything that we can do as far as oxygen support. And then you had, parents crying as they're seeing their kids for the last time. There's just a lot, and the nurses were there holding hands with, people and doing what we do best during that time. So I can't speak for everyone, but I can speak for my staff and myself. We put every ounce of effort into everything that we do for patients, their families, your families. It was soul crushing. And then there was the physical toll that came with that, all kind of lumped into it. And the physical toll was just pragmatically, you're wearing a mask with a mask and sometimes another mask, goggles, you're wearing double gloves, you're wearing, the gowns that you're going to love so fondly when you're in nursing school, and which protect you, and at the same time you curse. So you're wearing all these things and you're constantly running back. And when I talk about sick, they're on medications that you sometimes have to change every 5 minutes, every 10 minutes. Then you're going to your next patient doing that and then running back. So it was pragmatically, there was a huge physical and mental toll, to be honest. It was crippling for a while, honestly. They were really fragile for a while, and that was hard for me. And I know it wasn't about me, it was about them, but it was hard to see. But now, phase forward again, timeline, and we are where we're at today. We have a ton of hope, I think, as things hopefully change. We don't want to hope too soon, of course. We want to be grounded in that. But what the nurses have done is they've moved through all those phases, and now they're protective of their patient population. So instead of letting someone else come in and take over for their patient population, they've done such a good job with advocating. They have relentlessly looked up evidence-based practice to make sure that we're doing the best things, advocating for the right things, and really holding the whole team accountable. But they don't want to give that up, so someone has to start anew. So it's very important to them, and I can't be more proud of a group of people with them taking ownership of that and wanting to see it through. Of course, we're all hoping it's, eventually one day is over, but they did a great job with that. So the silver lining to all of this is that the nurses have grown exponentially, and they'll be able to take this wherever they go. There's some huge skill sets advantages that they grew into, whether that's CRNA school or whether that's a nurse practitioner, ClinSpec educator. It really did a lot. The silver lining is they took advantage of it in the best way that they could. I will say that I turned a blind eye to whatever music they wanted to play during this process, which burned the ears maybe of some of the directors that walked through the unit, but we had to have a little fun with it. So if you liked autonomy mixed with a tremendous amount of camaraderie, that was the unit to be in. That's the ICU in general. And then, I think the mental fortitude that it took while it was taxing, it was extremely rewarding. So as a nurse leader, from my perspective, I ran a lot of parallels with the staff. So it was very important to me to make sure that I would do everything that I expected my team to do. Getting in with the patients, taking care of COVID patients. I picked up a couple shifts in the COVID ICU, made sure I was in there to help when we trached patients, make sure I helped transport patients. It was very important to me that I was there for them, whether that was working at 16 or whatever it was. It was very important to me. But I think 80% of being a leader during that time was just listening and being present. Did all my work out on the unit as much as I could. It definitely, it hurt me a lot to see them kind of a little helpless there for a while. But it's nice seeing our hope get back. Our committees are restarting. We're really moving in the right direction. And WellSpan actually did a great job for us, not to toot our own horn a little bit. They hired in a bunch of COVID travelers that could do ECMO and things like that, which gave us such a huge relief, and really helped our staff out. It was awesome. I actually only lost 2 team members during this whole COVID year. One left because her husband got a nice job somewhere, and then another one left to travel. So they really stuck together on this. So I'll soon field a few questions on the COVID content, but I want to do my due diligence and sort of honor where I came from here. So your college was a place that I absolutely loved. Obviously, I went there twice, much to my parents' dismay. But the experience was awesome. The orientation was so good that I came off of, or the clinical setting and what I learned, I came off orientation, I think early 4 or 6 weeks on my first job. I came off early on my next one. It was just I was well prepared compared to, other areas. And it was really nice. So if this is the direction you're going, or you're already here, I'm sure that you know that it takes a lot of camaraderie, I'll use that word again, to get through the studying, to get through the class. And I'm sure the virtual component adds a whole new thing. But I still keep in contact with a lot of my professors today. Some of them I work with, and we do a lot of projects together. And honestly, the other piece that I want to add to this is my spiel on new grads. This is my own personal thing. I think when I was at York, they constantly told me, what advantage are you going to have when you go into a workforce and you have all this experience around you? Because I wanted to be in an ICU. And I had several people tell me, no, you can't go to an ICU first, you can't go to an OR first, or many different places. And at the time they said, well, what you have is that you have fresh EBP, you're moldable, you have passion. And fast forward to now that I'm in charge of a hiring process, that's what I hire. I have repeatedly selected new grads over experienced nurses over and over again. I have many York College students that I have hired. After they do their clinicals, their externships, I will take moldability, passion, fresh EBP over someone that's stuck, So that's my little spiel. So I'm up for questions on York, the pandemic, not my puppy, because I haven't got him potty trained. He's really frustrating me. So what kind of questions do you have for me?
Colby, I'll break the ice. I teach anatomy and physiology at Dallastown. I have a couple students watching tonight. Could you explain what ECMO is? I understand that sort of, but I don't know what the viewing audience knows what ECMO is. Yeah,
so ECMO, like I said, it was like a bypass for your lungs, but there's VV ECMO, VA ECMO. So it depends on if your lungs are the problem or the heart is the issue. Really, it takes the blood out, puts it back in, removes carbon dioxide, and oxygenates the blood. So when their lungs are to compromise the patients to do any function whatsoever, we put them on ECMO to oxygenate, and then we let their lungs recover, or hopefully recover during that process. Those are their big honking cannulas that are probably the size of my fingers. A little nurse will come out of me, and it's an exciting patient population to take care of.
Well, I hope some of my students have questions, but I do have one. So Colby, we had talked in the spring to some of our students who worked in New York City, and the one thing they kind of said was some of the symptoms that surprised them the most about COVID that I think were unexpected in caring for the patient. So I was just wondering if you could speak to that and some of the maybe challenges or, care that was maybe unexpected in what seems to be a respiratory disease at the surface level.
Yeah, so for us, when they came to the ICU, it's a little different because they are experiencing that nth degree of respiratory issues. I think the surprising piece to that is that we would recover, extubate them from the vent. They think they're doing okay. We'd send them out to a med surg floor. And a couple days later, they'd slip back and they would be coming back to the units, having to be reintubated. And sometimes there'd be a cyclical process. And the nurses started to get a feel for that and advocate, no, we need to keep this patient a little bit longer because they're going to bounce back. And then sure enough, a day or two later, they would be reintubated. As far as the other symptoms, I think a lot of that in the ICU is masked because they're intubated. They have fecal incontinence tubes. Managing some of the other, we're controlling temperatures a little bit more. So some of those other symptoms are hard to see. Now, what we did see a lot of peripheral vascular issues, horrible flow. We had people that would lose limbs. We had, a gentleman that feet and hands were black entirely. Now, unfortunately, he didn't make it. But a lot of issues like that, where you have that peripheral issue, a lot of skin issues, a ton of pressure injuries related to that flow issue. So I think from the ICU perspective, that's what we've seen the most, aside from the lung, is just that horrible vasculature change. Now, I can't give extra credit for questions, but I think she can add like at least 10 more.
Colby, I have a question for you. So through all of this, and when you were just kind of learning about the whole thing, you say at the early stage, what kind of things kept you up at night?
I think what kept me up at night were a couple different things. Staffing, being stretched a little, and trying to come up with solutions for that. We trained an entire additional unit in ECMO because of how many ECMO patients that we were having. And that was the nurses really stepping up and doing that. But really, what affected me probably the most was when they were in that phase where one nurse had maybe 3 shifts in a row of her patient dying, and she was crying right before work, crying after. We had an appreciation dinner that WellSpan actually had through for my units, and during that she broke down, and that was like, you feel helpless. I am close with all of my staff. I remember everything from their children to their hobbies. It doesn't matter what it is. So I know you're supposed to keep a layer between your staff and you. I do not. I believe in close teamwork, and that's how we move forward. And that was hard, very hard.
Looks like we have a hand from Ruth Ann Williams. You can go ahead and ask your question if you want to unmute.
Hi. So about the COVID-19 ICU. So if I were to be an incoming freshman and the second year, would anything happen? Because that's the one thing I was concerned about, was going in and automatically, like, second year, the coronavirus wouldn't go away, so we'll have to deal with it. Would that be a possibility?
So are you saying as far as a fear coming into the unit itself?
I'm not afraid of going in there. I'm just wondering if I'm going to go in there and we're still going to have the same problems in a couple of years.
I can't speak to that, to be honest. I'm not sure how long it will go. I think there's a lot of different predictive models, and each of them have been changed along the way. I know there are variants out there that we're looking at now, variants that the CDC is watching. So kind of as a segue, I'll still touch base on the point of that fear. And I know that wasn't part of your question, but I think it will help people moving forward, is that fear also went away once my staff realized that the nurses that were getting COVID were not the COVID nurses. They were the nurses out on the floor, which was very different than what they originally thought, because we were fully gowned. We were fully protected. So the nursing rate of getting COVID in my unit was much less compared to the non-COVID floors, because you don't know what patients you're getting there. You're lulled into a false sense of security. But it also speaks to the fact that no matter where you are in nursing, you have to do the basics. Protect yourself, wash your hands. You know, right now it's, you know, wearing masks. You know, those basics are important no matter where you're at.
And I'll just jump in, Ruth Ann. Our sophomores would not be in an ICU. The only students we have would be our seniors. And, you know, we did have to combat some of the fear over the summer in particular. We were getting a lot of questions from our students about returning to clinical. And so we held a webinar, and we had one of Colby's employees, probably Travis, helped us out. Does Travis work with you, Colby?
Travis, yes.
Yeah. And so we called on a couple of our students to kind of share those fears. And I'll just say one student and her parents who were particularly fearful, that student now emailed us this semester and said she's ready to go and ready to go to a COVID ICU. And so I think what I am most proud of with our students is that all of our students in clinical did return for the fall semester, and that was about 300 students in clinical. Nobody dropped out. And, you know, what we did see initially was our sophomores were the most afraid because they were the least experienced, and they also felt like they had nothing to contribute when they went in. And that is not what we've seen in our juniors and seniors. So we're really happy to see that, you know, they've really taken that responsibility seriously. And when we had to tell our seniors they had to go home in March, they didn't want to go home. And so, you know, I think unfortunately COVID might be around for a little while. We had another presentation by an alumni on Tuesday night talking about vaccine development. And, you know, he said we may have to learn to live with this, and it might be something that we have to get vaccines for, like the regular flu in the future. So.
Just to add a little bit, I teach the senior class. So we've worked really closely with WellSpan in that we fit tested all of our seniors for N95s. And if they would like to be in a COVID unit, we never force them into it, but all of them are like, yeah, we want to do this. So we have fit tested them so they can go in safely, and they are learning a lot from those opportunities. But like I said, if somebody says, hey, you know, I'm just too nervous, we never make anybody go in, but we're finding it's kind of the opposite, that everybody wants to experience it. And that's a big change from back March when, you know, we weren't anywhere near the COVID patients, because as Colby said, we're really learning what we need to do to care safely for these individuals. So
it looks like there's a question from Jack. So PPE, yes, at the beginning everyone was nervous that we didn't have enough PPE. Actually, we never had an issue. We were very careful. What we used initially was a hot zone, warm zone to preserve PPE, where you were in for 2 to 4 hours, then you came out and you got a break for 2 hours. So that really helped us at the beginning, and now we're really good to go. But we actually never ran out of PPE. We never had any issues. I was very, very thankful for that. Elena. So I started actually on 4 Southwest, which is a medical surgical floor here. I was a nursing assistant there, and they have a mix of like vent and telemetry patients, CHF patients, very sick patients. Some of them should probably belong in an ICU. So it helped me with my time management, which made the transition easier. But I can speak to, as far as starting in the ICU, we hire a ton of new grads, including Travis, where it's nice first, and then it kind of gets you acclimated to the environment. But we do a great job with our new grads. The orientation's longer. We make sure we don't take you off too early. We'll push you because it's the ICU. There's a ton to learn, but it is more than feasible. If you have the wherewithal to really study outside of when you're actually at work, it's definitely feasible, and it can be one of the most rewarding experiences. Lisa, Dr. Rustad, okay. So what am I most proud of, and what I have learned, and what I'll carry into the future? A lot of different things. I think I'm happy about the mistakes that I've made along the way, which has helped me. And at York, the EBP, at the time, I didn't take advantage of it as much as I should. And that piece that I took advantage of is now helping me in my master's degree, which is helping. So that kind of came forward and came full circle again. And I am now implementing that in my units. My practice and quality team, we run purely based on evidence-based practice. So I can't beat that drum enough. It's probably the evidence-based practice that at first, it takes a while to getting into articles. But once you do, you realize the benefits it has for your patients. And that's what it's about, and bottom line is about your patients. All right, Danny, have you found that that with the pandemic, nurses were leaving the profession? I think other floors had that issue, and I'm not going to be arrogant and think that for some reason our floor was different and that it didn't. We just happened to, beforehand, we did a lot of team building exercises that I think held into it. So we have a ton of holiday parties that we get together. I don't know that this is that professional, but I had scheduled a beer pong tournament for both my units at my house. I know that's probably not the best thing to say, sorry. But we do a ton of different activities together to really forge us together. And when we got into this, they didn't want to leave each other. They thought it would be failing, and it was okay. It would be okay. Honestly, if they left, I support that. Nursing is about flexibility, growing and moving around. I think now that we're getting out of this, they're going to start to apply to different areas. So there'll definitely be spots available. I know I just hired another person today to open heart ICU. I have one position there. So there will definitely be spots for interested people all over the hospital and many different hospitals as people take this moment and say, all right, let's go back for nurse practitioner, and let's go back for different things.
Hey, Colby, I think we have 2 people with their hands raised, and then we can jump back to the chat. So Lizzie, why don't you unmute and ask your question? Thank you.
So I have more of a general question, but what's one thing that you wish you knew before going to nursing school or before becoming a nurse?
Ooh, that's a really good question. What's one thing? I'm going to be pragmatic here, and I wish that I would have became a nursing assistant sooner. I know that there is a balance between making sure that you focus on school and making sure the work aspect. And from my point of view, if I would have became a nursing assistant sooner, I could have gotten forgivable loans for school. I could have gotten tuition reimbursement from WellSpan, and I'm sure many other places could probably speak to that. That's what I wish I would have done sooner, which would have helped mitigate some of the loans. And it also, even the year that I was a nursing assistant, helped me learn a ton of things that helped orientation, truly. So I think that pragmatically would have been what I wish I would have done.
Gershon, go ahead.
I had more of like a question as to how you dealt with going back into ICUs, knowing that more and more people were going to die, and how you dealt with that, like personally.
Yeah, so for me, it's a little bit, I think different people handle things so different. There's sympathy versus empathy. Like there's a ton of different ways to deal with it. I black box it. When I leave here, I put it all in this box, and I don't reassume that box until the next time. But that's easier said than done. And my staff weren't able to always do that. That's much easier for me as a leader to say, because they're the frontline staff. So I think, honestly, they took it home. They cried together. And beyond just the isolation of COVID, you can't do anything. So those team building things went out the window. You couldn't get together. So that was hard. So I think the only thing that I could do is WellSpan offers like EAP, some assistance. We offered that. Chaplain services, they were involved with delivering different words of encouragement and gifts and different things. The community actually pulled together and delivered gift after gift after gift. We can't thank them enough for that. And they still are doing that. But to be honest, I don't think many people dealt with it well. And there's, when it's death after death, that's a little hard to chew. We are a cardiac arrest unit, so we do see a lot of it, but not that much. So I would think better.
And I'll jump in. I talked to one of our students the other day, and she's a nursing assistant, and she worked on a floor that had a lot of deaths. And she actually told me, I was so impressed by her. She's the senior, that she actually implemented a moment of silence on her unit when people died, because she felt that they were having so many deaths, and that was something that they weren't used to. And she felt like she had become a robot. And that she didn't feel like that was okay when families didn't have their loved ones there with them. So she actually, kind of took it upon herself and worked with her unit to, do something like that. So I thought that was really great. And she's going to have a chance to present with me at a conference coming up, at the WellSpan EVP conference, and share some of, what she learned. And sometimes it's just something small that someone has to do. And, we're looking for ideas as well in education. And our new psych faculty just offered to do a mindfulness exercise once a week for our students. So we're going to be implementing that very soon as well, to just help, develop those skills of, what do you do with emotions when you're not sure what to do with them.
Yeah, and kind of I want to segue to that. My open heart team years ago implemented critical debriefs. So when things are built up too much, they get together. Their scheduled debriefs, and then there's critical debriefs that help a lot out, help with that as well. Great question. And thank you, Taylor. I really appreciate that. Hopefully we did the dawning and doffing ivory tower fashion while you were here. Have you been noticing not only a lack of nurses specifically, but of the medical profession in general as the pandemic continues, or have you been noticing a surge in this inspiration for the career? I'm kind of in this bubble. The cardiac ICUs are typically sought after for different reasons, whether that's to be a part of it or for the progression into CRNA school, NP. But we did see, I know the floors saw a large turnover. I know 5 South, which was, the COVID unit, they banded together. They did really well, but you can only do that so long. So they made changes to other areas of nursing. But I think right now we're still in a shortage of nurses in general, but WellSpan's done a great job of supporting that with travelers. We're doing things like the extern program. We hire, we're taking on maybe 30 externs. So remember when it's time to apply for that. Not only here, Hershey has an externship program. There's many different areas that have that. We're trying to get people into nursing assistant roles, PRNs, so we can hire them. So there's a lot of effort being made to mitigate some of that, which is pretty awesome. Thank you so much. So Elena, if you're interested in the ICU, definitely let me know as you get closer. We can do overhires. So 6 months out is usually typically how far I'll do an overhire, which doesn't take away from the openings that I have. So just consider that. What words of advice do you have for new and aspiring students who are interested in becoming a nurse? We all have different personalities, I think. We get into nursing for different reasons. I think the typical one is to help people or different things like that, but there's not one wrong reason to get into nursing. And what's awesome is you're not stuck. You get that first year of experience and you can really move around to whatever you want to. Some people like patient contact and that's what it's about. Some people don't, and nursing has a place for them too. So don't feel guilty in your specific subset of feelings for nursing, because each of them have values somewhere. Whether that's an OR and you're very procedurally oriented, whether that's psych, there's, the education piece, there's research where you're kind of from an eagle eye view. I don't think you should ever feel guilty when everyone else is telling you this is why I got into nursing and yours is vastly different. Each of them have extreme value. What qualifications are needing to be a nursing So if you're, as long as you took nursing 210, I think that was, I don't know if it's transformed since then to something else. The assessment course you can test out. There are not many, PA does not have, it doesn't require like the CNA license. So there is a course, you know, you can hire that they'll teach you at different places. So there's not many qualifications that you need. I've hired people from Giant. I've hired people from different areas. I'm more concerned about, honestly, raw material than I am the experience. I know I've said that before, and I don't want to sound like a broken record, but the core of who you are, when it's quality focused, it's patient focused. And we like to have fun. This is a stressful environment. We love sense of humor. The nursing sense of humor, with jokes that probably aren't appropriate for anywhere else. So, you know, it's more about the core of who you are and not necessarily a list of qualifications. So if you're interested, you could always email me afterwards and I can help facilitate that. Or I'm sure Kelli can help facilitate that as well. The psych ward, I can't speak to it tremendously on how COVID has been handled there. It's been difficult because typically, so yes, York has a psych ward and has it's split into 4 different sections. And I still actually remember that fondly when I went to college. I can still remember doing the mindfulness exercises that Stacy mentioned earlier during that. It was hugely beneficial then. So it's been difficult because you can't have those patients together. So if they're COVID, they can't be, you know, with all the other patients. So they've had to be out on the floors, and they have to be a little bit more vigilant with the support that they're getting while they're out in a normal room.
Ashley, your hand's up. You can unmute and go ahead and ask your question.
Hi. So with COVID having such devastating effects on the hospital and nurses, and you know, them going through such traumatic experience this past year, do you think that like in the coming years with these new grad nurses, like that there'll be a greater divide between them having experienced that versus these newer grads not experiencing it?
I think that's a good question. It's a good worry, but the truth is, I think I have to reverberate the COVID's just the newest piece. There will be many more things that will forge you together with that closes that divide. You know, just being open to change is the hardest part about being the nurse, because we're supposed to be the bastion of change, yet sometimes we're a little hard-headed. You know, so I don't foresee a divide, because I think there's going to be more things. And I think, you know, when you get in there and it's about the patient, you make it about the patient, all those other things melt away.
I've got a question, Colby. I'm big on leadership. It's huge in my industry, and you described yourself as a camp leader. So or as a nurse leader, you're a nurse leader. How have you developed as a leader throughout your career, and did YCP play a role or have a foundation in that?
Yeah, that's a good question. So you know, I hate to keep saying this, I went twice, but it did actually help because now I'm doing a dual master's degree, MBA, MSN. So through the finance and the nursing portion, leadership is something that is constantly drilled. The definition of a leader, you know, just because you're a good nurse doesn't make you a good leader. Just because you have many other qualifications doesn't make you a leader. I think the piece that you learn in York is not just a leader, how to be a transformational leader, which is very different. You can become a leader, and that's a great thing, but to be a transformational leader, which is something I believe in entirely, and it's backed by a ton of evidence-based practice, is that you're looking to transform the people around you into leaders as well, so that they're independent, functional leaders that are all working together in one cohesive group. So if I learned anything, it was how to be a transformational leader, which is 10 times the weight of a leader.
That's awesome. Thank you. Anyone else, if you'd want to raise your hand or just unmute and go ahead and ask. Chat's still open.
I have a quick question. But this is about like your college in general. Um, does your college have like, I know obviously like you guys have like ways to help kids get into, for example, medical school, but do you guys have like maybe specific programs for more specified like jobs in medical field? I know it's not about the ICU. I'm sorry. I know.
No, that's all right. Yeah, Stacy, if you want to jump in, there's a number of health profession majors at York College. Stacy knows more.
Sure. So, I mean, obviously we have nursing, but the other health professions we have are medical lab sciences, radiography, nuclear medicine, and respiratory therapy. We have a new major in healthcare administration, which is to be more concerned with, you know, the business side of healthcare as well. So those are our four. We do have students can major in biology, and if they want a career path in pre-med, or, you know, thinking about going to pharmacy school or physical therapy or occupational therapy, so that path would be different because that's more of a major in biology rather than kind of a major that is, you know, set for health sciences. It's a little different curriculum. As far as nursing, then we also have graduate programs in nursing. So we do have nurse practitioner programs, we have a nurse educator track, and we also have a very large nurse anesthesia program, which is a doctoral program.
We have another question. Maybe you can help with this one too, Stacy. How do you get into the nurse practitioner program?
Sure. To become a nurse practitioner, you first have to be a nurse. So you have to have a bachelor's degree in nursing first. And we usually require, you know, or recommend that you have a couple years of experience before returning back to school, just so that you have some experience to build off of as you become a nurse practitioner. So that is about a 2-year program part-time. So most of our students work full-time or part-time and then go to school part-time. I'm sure Colby is working full-time as he's going to school.
I saw a question there too about recommendations for high schoolers to gain experiences to see if they like nursing. My recommendations would be to check out what's available as far as shadowing. You know, try that. A lot of hospitals also have volunteer opportunities. Right now, things are kind of shut down because of COVID, but I think things will start, you know, opening up because there is going to be a need. And I'm hoping that a lot of people will really be interested in the healthcare field after things settle down. So those would be my recommendations for high schoolers, and feel free to add anything that you guys feel.
Yeah, I know most of the hospitals in the area. I know COVID has affected it, but if you go on their website, there is a process to get apply for shadowing. So we do get high school students into shadow, which is a good opportunity. And as far as what Kelly said, I don't think this will deter people from becoming nurses or getting into any sort of the positions in the medical field, because we still got into it for the same reasons. That hasn't changed. I still have an amazing time jumping in with the staff and enjoying the full. I love A&P, and that hasn't changed, James. So honestly, that never changes. And if you're into many different aspects, I think we'll still see a good surge in nurses.
Go ahead, Kristen.
Okay, sounds
Thank
good.
you.
Hi, I'm Kristen. I was just wondering if you could write down your email in the chat, or if you could say it. So if we wanted to contact you with any questions or like talking about the nursing assistant, that would be wonderful.
All right, it's in there.
Thank you so much.
Anyone else have any burning questions. I guess as a wrap up, Colby, just you had more years than others. So, well, I think you're going to put that in the chat. You said, sorry, your email.
I accidentally did it privately. I apologize.
Oh yeah. So yeah, he'll get that sent to everyone. But as a kind of a wrap up question, since you had some extra years there, do you have any memorable moments or favorite YCP memories to share with everybody?
That's a good one. Like I said, I loved A&P class, and I know Stacy would like me to say I liked pharmacology. I guess that was fun too. Honestly, it's the process. So it's the process of it's nursing's hard, and it should be hard because you are caring for someone's loved ones. But when you have anything that hard, it does, I hate to use the word forge, but it does really forge you together more. So I think those pieces, I'm still in contact with many of those people. Now it's a little bit different because they've been there and now they're in their own leadership roles or they're in advanced practice roles. So when I have questions for different things, I still Facebook them and ask different questions, or I call them to get more than just my own insight on something. So I really think it's the process. You know, as you get through it, you're just close. And there's not many other, when I went through finance, as awesome as that was, there wasn't that close camaraderie. There just wasn't. It's just different. And I think that's the part that I take away from that. I still remember sitting in the lobby right before the next class, everyone reviewing things together. You know, there's a nice gym. It was just that. I think it's the camaraderie. You get close.
I think that that connection is a common thread for many YCP alum and even the faculty and staff. So definitely something special. And as a rec major, we shared the lobby with you nurses. So, you know, there was a little overlap there. My roommate was a nurse. And so I think just by, you know, being there, I soaked in a lot of that pharmacology. Probably Stacy, you and Kelli, your lessons have come into me somehow too. So again, thank you all so much. Thank you, Colby. Thank you, Stacy. Thank you, Kelli.